The InnoScreen COVID-19 Antigen Rapid Testing Kit is used for the qualitative detection of SARS-CoV-2 viral nucleoprotein antigens in human nasopharyngeal, nasal and oropharyngeal specimens. The test serves as an aid in the diagnosis of infections with SARS-CoV-2. All InnoScreen rapid tests are for professional use only. Before using the test, scan the QR code and download the instruction manual and familiarize yourself with the test kit. Check the expiry date of the kit before using and do not use damaged test pouches. The InnoScreen COVID-19 Antigen Rapid Testing Kit components. Individually packed test cassettes. Extraction buffer tubes. Tube stand. Swabs for collecting samples. Procedure. To perform the test you will need InnoScreen COVID-19 Antigen Test Kit, gloves, PPE, and a timer. Ensure that the test devices are at room temperature before starting. Place the extraction buffer tube with the smaller mouth facing down into the stand. Unscrew the cap of the larger mouth of the extraction buffer tube. Remove the swab from the sealed pouch and collect the sample. Insert the swab tip in the extraction buffer tube and break the handle. Discard the broken handle. Replace the larger cap onto the extraction tube. Make sure the cap is securely tight. Squeeze the swab tip inside the buffer tube for 10 to 15 times by pressing the swab against the walls of the tube. Invert the buffer tube and place the larger mouth of the buffer on the surface. Remove the test device from the pouch and place it on a clean flat surface. Write the patient or control identification on the test device. Open the extraction tube from the smaller mouth and then add 3 drops of the sample to the sample well. Replace the cap. Start the timer and set it for 15 minutes. Read the results at 15 minutes. Visual result interpretation. 2 lines, one in the control line region and another one in the test line region, indicate a positive result. If only the control line appears and not the test line, the result is negative. The control line indicates that the test has been performed correctly and should always be present. If no control line appears, the result is invalid. Repeat the test with a new cassette. Once the test is completed, discard the tube and the test device as per the regulations for discarding infectious waste.